do my best. Hopefully I'll be able to advance these slides appropriately as well. But I hope you're all here to learn how to take aim at your lower back. And we're going to go over the 5 things that you can do today to take care of your back. And before I get started, I wanted to kind of get a sense of how many of you are actually currently having back pain, and versus how many of you have had back pain in the past and are just trying to keep it away. So in the chat, if you could please put current pain or past pain, just to give me an idea of where everyone is at. And I'll take a look at that later. Let's see if I can get, okay, so let me just introduce myself while everyone is doing that. My name is Carina Escudero. I am a physical therapist, and my practice is at AIM Sports Medicine. We're in Hermosa Beach on Aviation between Prospect and PCH. And I've been a physical therapist for 25 years. It's scary to say that. I'd like to pretend that I started when I was like 10. And at our practice, we're not just physical therapy. We also offer other services like massage therapy, sports acupuncture, sports medicine chiropractic, and stretch therapy. But our predominant thing that we offer is physical therapy, and I have a great team of physical therapists there. I've included my email at the bottom here. It's very simple. It's carina@aimsportsmedicine.com. Because I will give everybody opportunities to ask questions, but sometimes your questions kind of come up after the fact. So I welcome anyone to send me an email if you have a question, and I will do my best to answer it. And I will also have my email again at the end of the presentation, but hopefully it's pretty simple to remember. The other thing that I wanted to do is get some feedback, because believe it or not, this is my first Zoom presentation. I am very used to and comfortable presenting live, and I have done so at the Center for Health and Fitness at past events. And so I really, I enjoyed obviously presenting live, and I've done that for a couple of years, and I'm so appreciative that, that you guys welcome me back each time, because I love speaking to you guys. You guys are such an active part of our population, and it's always so encouraging to see everyone be so interested in health and be interested in staying active, and you inspire me to stay active as well. So I do have a feedback form to help me make these presentations better for the next time. There is a link to a we're going to hopefully be posting the link to the Jot form questionnaire in the chat. And so for those of you that have never used a link in a chat box, I think if you click on it, should open you in a new tab, but you could also copy and paste it into a new tab so you don't lose our feed here. So hopefully that makes sense. And thank you, because I really do appreciate the feedback. Even things like I'm talking too fast or I'm talking too slowly, either one just helps me to be present better next time. Okay, let's see if I can get us moving to the next one here. All right, so here's a little overview of what I'm going to cover today. And because this is a Zoom presentation and not in person, I really wanted to give you things that you could do at home today without anybody's help. So the 5 things that we're going to cover are posture. You kind of probably knew that that would be in there. Number 2 is keeping the hips moving. Number 3 is keeping the upper back moving. Number 4 is tightening your stomach, and I'm not actually talking about sit-ups or anything like that. I want to give you something super simple that you can do throughout the day. And number 5 is most important, is to not ignore your pain. Let's talk about posture first, and I'm talking about posture both in sitting and in standing. Because if you think about your day, you probably spend most of your time doing either of these two things, and hopefully you have some movement and some exercise sprinkled in there. But I think posture is one of the things where you can get the most bang for your buck because we do it so often. And if we can practice good posture every time, you will be saving your back in the long run for forever, really. So what's most important is that you want to stack your head on your shoulders on your hips, and if you're standing up, your hips on your feet. And there's two really good cues that I like to give people. The first one is pretend you have a string right at the front of your chest and it's pulling you up, straight up. And that is a great way to kind of lift your rib cage and get your chest up and open. The second cue that I like to give is think about pushing your shoulder blades out and through your heart. So we always want to open our heart anyway. So think about pushing your shoulder blades out and through your heart as a way to create better posture. The second thing is to keep your hips moving. So the lower back is a group of joints that is in between your hips below it, which are very mobile, or should be, and your rib cage above it, which is also mobile and should be. So the number 2 tip is to keep your hips moving. When you keep your hips mobile, then you decrease the amount of stress that you're placing on your lower back. And let me show you an example here. This is a picture of someone that's running, and if you notice, the mobile on the bottom represents where the hips are, and the hips are rotating with the pelvis. Up on top is the rib cage, which is also mobile, and they actually are counter-rotated. So the chest is rotated one way, the pelvis is rotated the other as we run, as well as we walk. And in between is the lower back, which we want to be stable. Now, if you have a limited mobility in your upper back or your hips, we give the expression that you have to borrow that motion from your lower back. And when you borrow the motion from the lower back where it's supposed to be stable, that's when often you will come into a back strain or pain. So here's a very simple exercise that you can do right now with me to help improve the mobility in your hips. It's a hip stretch. So I want everybody, while they're, because I think almost everyone is sitting, I want you to put your foot on your other knee, pick a side. We'll do both, don't worry. So put your foot on your other knee. Keeping your back flat, I want you to gently bend forward from the hip joint. And you should feel a stretch in kind of the butt area and the butt muscles and in the hip joint, which are deep inside the butt muscles. Okay, and now I want you to take 2 or 3 breaths, and as you exhale, I want you to relax into the stretch a little bit more. And take a breath in and exhale into the stretch a little bit more. Stretching should never be painful. It should be a stretch awareness, like you can feel like something is happening, but it should never actually be painful. So I like to do it with breathing because it will always help you relax. All right, let's switch sides. Put your other foot on your knee. And if it's too difficult for you to get on your knee, just straighten that leg out a little bit more on the bottom so that you don't have to lift as high, and just do it wherever you're able to get to. Again, keep your back flat. I want you to gently bend forward from your hip joint, and you should feel a stretch in the buttock, and deep inside is the hip joint. Take 2 or 3 breaths, and as you exhale, you gently stretch a little bit more. Okay? All right. Great job. We've worked on the hips. Are there any questions so far? I'm going to stop sharing, and I'm going to look at the chat and see if we have any questions so far. I see quite a few of you have had past pain, some of you have current pain. I'm actually happy to see most of you have past pain, so I'm glad that you're here to learn how to keep it away. Okay, any questions at all? If you have any questions, please type them in the chat, and we will have time for Q&A at the end as well, but I always like to stop halfway. Okay, I don't see anything. I'm going to move back. All right, number 3 is to keep the torso moving, or the rib cage area. We need to keep rotation through the rib cage for all movements, especially walking and reaching for things. Now, one thing that I notice is as people get older, we tend to stop swinging our arms when we walk. How many of you can actually relate to this, or even knew this about yourself, that when you're walking, you're no longer swinging your arms very well, or they're staying right by your side? Or start noticing if you're out on your walks. Hopefully you're all able to get out and walk, since I know that the gym is closed. But notice how many people actually have very small motion in their arms because they're starting to lose mobility in their upper back. So the first thing you can do to get that mobility back is make an effort to swing your arms as you walk. This will help with that rotation in your rib cage, which will also help with the rotation in your hips and pelvis, and it will help you keep your stomach, or your lower back from moving excessively. The other thing I want to show you today is called a torso stretch, and you can either do this sitting down where you are, or in standing, and you can even do this walking. So you could do this as you walk around your house if you wanted to. So all I'm going to have you do is reach one arm straight up to the ceiling, and I want you to think of lifting your ribs off of your waist. Okay, so it's not just a shoulder stretch, it's a rib cage stretch, kind of elongating your body. Okay, now let's do the other arm. Reach it up, lift your rib cage up and off of your waist. Okay, let's go back to the first arm. You're going to reach up, and now you're going to reach across like you were getting something up off a top shelf. Okay, and then you're going to take your other arm and reach it up and across. Let's go back to the first arm. This time you're going to reach up and rotate back just a little bit. And then the other arm, reach up and rotate back just a little bit. Okay? All of those help to loosen up the rib cage and the torso so that you have more mobility there and can avoid kind of stealing that motion from your lower back. Number 4 is keeping the stomach strong. And it's interesting because when I looked for pictures to represent this, there were 1,000 pictures on planks and sit-ups. And that's not actually what I'm talking about. Yes, some of those exercises can be appropriate for certain people, but what I want the stomach to do is help you create tension around that lower back so it stays stable when you're moving your arms and legs, when you're rotating your upper back and your hips, when you're walking, when you're reaching. And so this is the one exercise I found where you're rotating, so the person would be keeping their stomach tight while they rotate their rib cage to bring the ball back and forth. Now, tension in your stomach or your core stabilizes your lower back like a natural corset or back brace, and that's what it's designed to do. Let me show you a picture of what that kind of looks like. So this is a good picture of where all those abdominal muscles are, and you see that they wrap all the way around to the back. So when you create tension or good tension in your stomach, you are creating a natural corset around the spine, the lower back, and you're helping to stabilize it. So let's talk about how you can do this, because I'm not talking about really creating a lot of stress and forcing yourself there. You should be able to create tension in your stomach and continue to breathe, be relaxed, have everything from your rib cage up very relaxed. So I'd like everyone to try this, and this can be done in sitting, standing, laying down. In the clinic, I often start with people laying down, but it's just as important to have you doing this sitting up as well as in standing, because we don't spend all our day laying down. We don't spend all our day sitting or just sitting or standing. We have a combination of positions that we're in. So what I'd like you to do is I'd like you to pull your stomach in from the sides. So kind of pulling down and in from the sides around, if you can imagine your spinal cord or your spine in the center of your body. And you want to keep your back neutral when you're doing this. So I don't want you to round or tuck your butt under when you do this exercise, because nobody wants to walk around looking like Pee Wee Herman. So you're going to tighten your stomach, and some of the cues that I give is if you had to really clear your throat, you would feel your stomach tension right there. Or imagine yourself putting a tight pair of pants on and you're trying to get that last button fastened. You have to pull your stomach in to do that. The other example I like to give is if you're getting into a pool, or maybe you're actually a swimmer in the ocean. But as you're getting into the cold water and that cold water first hits your stomach and you immediately pull in a little bit and create tension. That's the tension that I want you to create in your stomach, and that is enough tension to protect the center of your spine and help you stabilize while you move your arms and your legs. So when is a good time to do this kind of practice? Because it is a practice. You have to have your brain understanding where your abdominals are so that they know to fire immediately without you having to think so much about them. So I like to tell people, if you're driving around, tighten your stomach every time you hit a red light and see if you can hold it for the entire red light. If you're at home watching TV, try to tighten and hold your stomach through commercials, or at the end of a show, if like me, you don't actually watch commercials anymore. Think of many different ways. If you're at the kitchen counter and you're preparing something or you're washing a dish, see if you can hold that tension while you're doing those activities. The more that you can practice, the better that you will help yourself have that natural corset around your spine and lower back. All right, the fifth and final thing that I want to emphasize is that you have to speak up and ask for help if you're having lower back pain. There are three common things, or three ways that we can deal with pain, and the first one is what a lot of people do, which is ignore it. Right? We don't have time to deal with the pain, or maybe right now you're not comfortable going in to see a doctor about the pain, or even to come into physical therapy, and we understand that. But ignoring it is not going to get rid of it. The second thing that people often do when they have pain is they alter it in some way. This might be putting a hot pack or a cold pack on your back, or taking an ibuprofen, something that helps decrease the pain so that you can get through your day, but doesn't actually do the third thing, which is fix your back. You want to be finding out what is actually the cause of your back pain, because everybody's pain is different, and the exercises that work for one person may actually create more pain in the other person. So I highly recommend that if you have back pain, speak up and ask for help, either through your physician or through physical therapy, something where we can help evaluate and figure out what the issue is and help you solve it and get rid of it. It is much easier to get rid of acute, which means recent pain, versus chronic pain. When the pain becomes chronic, meaning you've had it for a long time, you start to move differently. Other areas of your body become tight. Maybe you've stopped bending down to pick things up. Maybe you've stopped lifting your grandchildren. There's a lot of things that we stop doing when pain becomes chronic, and then we have extra things that we have to fix to get you all the way better. So, to summarize, the 5 things that you can do today to take care of your back. The first one is posture. Make sure that you're always sitting, standing in a good posture. The second one, keep your hips moving. You've got to keep your hips mobile so that you're not putting extra stress on your lower back. The third, keep your upper back moving. Again, you want to make sure that you've got mobility above and below the lower back so that the lower back can do its job of staying stable. Number 4, give that lower back stability a chance by creating tension in your stomach and tightening your stomach and practicing that so that your back you can have that natural corset and that natural back brace around your back. And finally, number 5, don't ignore your pain. If you're having a problem, speak up, get help. There are lots of ways for us to help you, both virtually as well as in person, and there's lots of things that we can do. And there's an opportunity in that feedback form if you actually are interested in starting some physical therapy. The form is really more about the presentation, but if you're actually interested in starting, there is an opportunity for you to request that as well. So again, please give me feedback in the Jot form link in the chat box. I really do appreciate it. I'm always trying to improve, and I want to make sure that I'm presenting things clearly, and it just helps me help you the next time.